Hi everyone. As we draw towards the ends of 2022, I'd like to pause and reflect on the incredible impact our people have had on our community throughout the past 12 months. From bushfires to floods and everything in between, our people have been a constant in the ongoing care provided to our broad and diverse communities. And despite again battling to incorporate COVID-19 in our everyday work, we continue to adapt and of course adopt in order to provide the programs and services that our communities so desperately need. In pure numbers alone, Eastern Health has had an incredible year. In the 12-month reporting period, we have had a total of 1.36 million episodes of patient care. Over 148,000 people came to our 3 emergency departments. 4,100 people were cared for in our inpatient mental health units, along with a further 266,000 occasions of mental health care in our community. Our specialist clinics were again very busy meeting the needs of our community, and this meant that nearly 280,000 people were either seen in clinic, via telehealth, or in fact by telephone. We also provide elective surgery for just over 12,000 members of our community. Across our maternity services, we welcomed 4,521 babies to our community, and congratulations to all those parents. If we look at COVID-19 support provided by Eastern Health, our pathology team processed nearly 193,000 COVID-19 tests. Care was provided for 3,420 COVID positive inpatients, of which 209 requiring ICU care across the year. The COVID positive pathways team managed 115,000 patients in our community, and our early treatment clinics prevented 964 people from developing severe COVID-19 disease. On top of that, 129,000 vaccinations for COVID were also administered. These are, you would agree, staggering numbers, and congratulations and thank you all. Yet despite the significant role we had in providing ongoing care for our community, we also were able to acknowledge a range of significant achievements throughout the year. Demonstrating our commitment to learning and research, more than 500 publications were created by our dedicated researchers right across Eastern Health. And through the Eastern Clinical Research Unit, we were involved in 252 clinical trials. Amazing. In March, our Turning Point service was appointed as Victoria's new statewide specialist service for people living with mental illness and substance use or addiction. In July, the long-awaited hybrid operating theatre was opened at Box Hill. Our fantastic new residential aged care facility at our Wanturna campus commenced operation in August, which is fantastic, and Balbert Private Hospital transitioned to become Eastern Health Blackburn Public Surgical Centre in September. Also in September, the Rethink Addiction National Convention was held in Canberra, which is aimed at changing the conversation and perception of addiction to truly make it a health issue. I'm also really pleased to say that in addition to that, this year we also launched our first Gender Equity Action Plan, launched our new ICT roadmap, our first Reconciliation Action Plan, and we launched right into the redevelopment at our Angliss campus. We're on the cusp of launching our new strategic plan, and I want to thank everybody who was involved in all of these projects. These are the foundations that will establish a bright future for us at Eastern Health, and I am incredibly proud as the Chief Executive of this wonderful organisation to be shared just a few of these highlights with you. All of the challenges, highlights, milestones and achievements have been shared by so many of our wonderful team. More than 11,000 people now work across Eastern Health, and I am grateful for each and every one of your contributions every single day. So on behalf of the Eastern Health Board and the Executive Leadership Team, I wish you a safe, happy and healthy festive season, and join with me in saying here's to 2023. Thanks everyone.